Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Special needs dentistry is a branch of the profession that focuses on providing quality dental care to patients with special needs. Pediatric dentists are equipped to treat children with special healthcare needs, sometimes called SHCN. If a child has special needs, they are likely to be evident in behavioral, mental, physical, emotional, and chronic conditions. Chances are these conditions will affect the child's oral health. Dentists adapt treatment to the individual needs of a patient. My guest is pediatric dentist at the Lagos State University Teaching Hospital, Dr. Bimbo Akindele. You're welcome to the show.
Thank you.
Okay, so I know that Down syndrome is a special needs, and I know that they may have a problem with their oral care. What are some other special needs conditions?
Yes.
You took the word out of my mouth.
So like you rightly defined, so basically any impairment that affects physical, behavioral, cognitive, intellectual, so any impairment that would require medical management, and would probably use specialized services, healthcare interventions. So those conditions, you rightly mentioned Down syndrome. So we also have cerebral palsy. We have children with autistic spectrum disorders. So even children with special sickle cell diseases. So basically any condition. So whether it's visual impairment, hearing impairment, so any condition that requires medical management is a special healthcare need condition.
Okay, I understand if a person has a mental issue. Okay. It could affect how the person thinks about life and maybe coordination or whatever. But why exactly do they need special care, or shall I say exclusive sort of care from dentists?
Okay, so depending
is it that the teeth are bent or whatever? Let's help us understand what we are facing
So
here.
basically, depending on the type of special needs you are dealing with, you tailor the management of that patient based on that particular condition. You mentioned Down syndrome, so in them you could have cases whereby they are usually prone to gum diseases, severe gum diseases, whereby we call it periodontitis, whereby their teeth becomes loose and then they easily they easily have tooth loss. So depending, so in that patient will be more careful to ensure that they properly clean their teeth because of their reduced immune system. They are more prone to having this gum disease. So there you have their scaling and polishing done more frequently, like every 3 months, and closely monitor them. So it depends on the special healthcare needs. For example, visual impairment, when they come into the dental clinic, because you know that they can't see you, so before you put anything on them, you could tell them, feel this thing, touch this thing. So it's actually a management tailored towards the particular special healthcare needs. We talked about cerebral palsy. So for example, a patient comes with a wheelchair. There are sometimes we even do the treatment, in that same wheelchair. So it's basically depending on, the medical condition, and that's how we tailor. With
all the special equipment you use, because I've sat in a dentist chair. And how can you do it in that chair? I respect that chair, man, because that chair can do all sorts of things. It can go up, down, it can flip back, and all that.
It can.
So how is it even possible? That's a lot of work.
Yes, but that's why as pediatric dentists we are trained, to handle. We see children. For you to see children, you have to really be patient. So we also treat, children with special healthcare needs, individuals with special healthcare needs. Okay, so we tailor. We don't just. We are very patient. We don't just come and open your mouth and there's a way. Sometimes we sing, we clap. They watch movies while the treatment is going on. Sometimes the dental chair comes with a monitor and all that. So just to make them comfortable, and then they're able to open their mouth and then do a thorough check.
I'm interested in how you can get an autistic person who doesn't want to be touched to open his mouth.
Okay, so for children with autistic spectrum disorders, usually because for example, if a child walks in, the particular dentist, pediatric dentist that sees that child, you may want to, stick to that particular pediatric dentist, even subsequent visits. So sometimes even before the child comes into the clinic, they may have like pre-recordings of what a dental setting looks like, videos and all that, so that by the time the child is entering, there's a bit of familiarization with the environment. So most times when they come the first visit, you may not necessarily do any treatment. You could come around, maybe if a child is being treated, you can take that child, walk up, just as a form of modeling, so that see another child is seated, opening the mouth and all that. So there are sometimes, even if you just get the child to open the mouth, like the child opens the mouth and you clap, hey, and he opens it again. So even if it's opening of the mouth the first visit to do a dental examination, that's a good one. So we take the treatment step by step, kind of like desensitizing them before you now start introducing objects into their mouths to examine, like, okay, you can hold it, see, it's just a mirror. Yes, okay, so they get used to it, they get used to you, and the next time they come, they are seeing you again, you are building rapport with them, you are friendly, the environment is friendly, you could have their favorite cartoons even being played and all that.
Okay, so what I want to ask now is, are there some of these children who can brush their teeth themselves? Let's start from the basics.
Yes. So because we understand that prevention is very important. Most of these children with special health care needs, because of their condition, most times the caregivers ignore the oral cavity completely, and then they focus on, it's the leg, it's the eye, it's this, and they completely forget, especially maybe they've been on prolonged hospitalization, they don't even bother cleaning the mouth. So cleaning is a very important issue with these children, because sometimes, depending on the kind of special health care needs, if they have the dexterity enough to like hold a toothbrush, there are ways we even modify the handles of the toothbrush, such that.
And then there are these good toothbrushes that use electric vibration.
Yes, vibration. So there are modifications. So
now I begin to see the crucial need for such toothbrushes.
Yes, so there are modifications in these toothbrushes, and then we show them how to brush. If they can't handle it themselves, we ensure that the caregiver completely takes care of it. So depending
Let's talk
on
about the caregiver.
Oh, okay.
Many parents hide these children at home. How is your special needs dentistry unit like? Do you get a lot of patients? And what's your method of sensitization? I mean, some people just are so ashamed.
Yes.
They just don't want to bring that child, not knowing that it's just making the child's life worse.
Yes. So there's a lot of stigma, they don't want to be seen with the child. But when they bring them to the clinic, first and foremost, we always like to applaud them, like, thank you, mommy, you are doing a very good job. Just to encourage them that, okay, you finally brought this child to the clinic. Although we make them know that, the first time you are supposed to bring a child to the clinic is before the first birthday.
Oh, is that right?
Yes.
Okay.
For every child, whether special needs or not.
You took it out of my mouth. So.
Yes, ma.
A child before 1 should see the dentist.
Yes.
Whatever for?
Okay, so let me explain. So a child before, so as soon as the first tooth, because first of all, cleaning of the mouth starts from day 1.
Which the parent does?
Yes, which the parent does.
Cotton wool and
we don't usually encourage cotton wool.
Okay,
like
the finger.
No, a soft cloth. You can use the finger brush for the tongue.
I thought I was totally
but ignorant. A soft cloth, clean cloth with warm water, and then just clean the gum pads and all. But as soon as the first tooth erupts, which is usually around 6 months, we expect to see that child. So, but even if you don't bring the child at that 6 months, we expect to see the child before the age of 1 year.
And what do you do with a child who has like 2 or 3 teeth? What are you looking for?
So there are several things we trained eyes. Apart from the teeth, there are a lot of lesions, swellings and all that could occur around the mouth, even before the teeth comes into the mouth. So usually we encourage that dental, we call it a dental home, whereby it's like a relationship with a dentist, pediatric dentist, with that child and then with the mother, such that, every information the mother would need to prevent. Remember we said prevention is key. So to prevent conditions, whether it's the tooth decay, whether it's the gum disease we talked about, whether it's maybe habits, counseling against habits that could cause that could cause malocclusion, which is disarrangement of teeth. So whatever condition, so they have the information beforehand when they come really early, and then they are able to put that to use such that their children are free from every form of preventable oral disease.
Okay, so these special needs children, can any of them be identified at birth?
Oh yes, several of them can be identified at birth.
Okay.
So for example, the cleft lip and palate.
Oh, definitely.
Yes, because you see that there is a defect in the face. So most times, the mother is like, but such children, when they come maybe at 1 or 2 days, the first thing we want to do is congratulations on your newborn, because some of them, maybe the husband has fled and all that.
Because of a cleft lip?
Yes, because of a cleft lip. So because of the ignorance, and that's part of the thing. One of the things we are doing here, increase the awareness.
But before we go on, let me just say that cleft lips can be repaired.
Yes, surgically repaired. Yes, it can be, and there are a lot of non-governmental organizations that even
do it for free.
Yes, that pay for this treatment, so it can be repaired. So usually we want to encourage them, put their heart at rest, counsel them on the things that needs to be done. Oh, it's treatable, with surgery and all that, and just make sure that they go, because they have it's multidisciplinary, so that they can go through all the relevant healthcare professionals needed to take care of them. And so we encourage them, and then ensure that they don't neglect the oral health too of the child, cleaning the mouth, eating right, the good diet and all.
What would you like to tell a mother who right now is hiding her child because she's so scared of the stigma? She doesn't know what to do. But this is a special needs child who you would like to see and examine the teeth. How would you encourage such a person to come out? Okay, so I encourage such a mother that, whatever the condition is, it's not your fault. Bring that child to the dental clinic. Preferably see a pediatric dentist who is specialized, equipped to, treat. And then you'll be armed with every form of information, counseling that is needed. Every form of information and counseling that is needed, to put that child through preventive treatments, and then, if there's any other thing, because I noticed that most times they come with late presentation. They don't bring the child early until, there's a swelling, the child can't, it becomes so advanced, whatever disease condition becomes so advanced. So we usually, solicit for early intervention. When the child comes for routine dental care often, like every 3 months, we are able to pick out, we need to do this, we need to do that, and then all the preventive treatment is instituted to prevent the disease from forming. I caught that, every 3 months. Yes, for children with special healthcare needs. It could even be a shorter duration depending on that particular condition. Maybe you want to review the next week or something. All right. This is where we come to the end of this segment. Dr. Bimbo Akindele, pediatric dentist at LASU, thank you for coming to the show. And we'll definitely bring you back for some more. Thank you for having me. So we're taking a short break now, and we will return with another aspect of health in a minute. Stay with us. Welcome back. The Orange Group of companies, makers of Procold, have come up with a new look for the product. Procold is a solution for cold, headache, flu, fever, and pain, which has been in Nigeria for several years. Joining me in the studio to answer questions about change in packaging and other customer concerns is the brand manager of Procold in Nigeria, Nicholas Alexandro. You're welcome to the show.
Hello.
I saw the new pack.
Okay, what do you think?
I like it.
Wow, thank you very much.
I think it's better. Wow, so I won't even ask you why you changed it, but well, let's leave it at that. Your tagline is fresh look and same efficacy. What are you trying to tell your customers?
Okay, so with this new packaging, as you know, Procold has been a brand that is trusted by Nigerian I think for over 35 years now. And throughout that time, we stayed with the packaging that you probably have seen all this time. So now we see that the world is changing. We see that the consumers' expectation is also evolving, and we also want to appeal to the younger generation. So that's why we come up with this new packaging to give a more modern look. But one thing that is important is that we still keep the efficacy. We still keep the same product inside. So the efficacy and everything is still the same.
So
same
nothing
formula.
has changed about the composition of the
Yes,
product.
Nothing has changed.
Okay, I like to think I'm part of the younger generation. Thank
Yes,
you.
are.
Well, when Procold was around, it was one of the few cold medications of that type that we had in the country, but now there are loads. So what is standing Procold out?
Okay, so what we take pride in Procold itself is that we understand our consumer. We try to understand them better. So we always conduct research to understand what are their expectation in terms of when it comes to cold medication, what they think that Procold could improve even more with our current product and also our packaging and everything else. And during every of our activity, our marketing activity, we always try to put our consumer in mind. So we know our consumer best and we know how we can target them and how we as a cold medicine can improve better to make their life even better also.
So correct me if I'm wrong, Procold is a medication that does not cause drowsiness.
Yeah, it does not.
It doesn't cause you to sleep, right? Okay, I remember that. But beyond the packaging, do you have any plans, for Procold?
Okay, so we see that Procold is actually it's close to Nigerians' heart. So that's why we always try to improve Procold, this is one of the way that we try to improve. We improve the packaging. We giving our consumer a product with a fresh look, so they even it can appeal to the younger generation. And aside from that, in terms of the product, we always try to improve as well. We always try to keep the same quality that people has come to know Procold for. That are some of the efforts that we've been doing.
Was some of this plan in a bid to stop people from bringing out fake and substandard products? Is that part of the plan?
That is one of the things that we have in mind as well. So Procold, as you know, maybe previously it was also with you that we have the campaign to the original movement campaign. So it was our partnership as well with the Pharmaceutical Society of Nigeria, because we see that the fake product in Nigeria is actually quite a national problem.
Yes.
So it's quite concerning. So we, as a leading cold brand, we also want to make the effort to give awareness to our consumer, to audience, that that there's the importance of picking the right product, picking the original product.
So that's it. How do they know the right and the original product?
Okay, so with this new packaging, what we try to do in order to avoid confusion, because we don't want people to think, oh, this is the different from the Procold that I know before.
Yeah.
I think this is a fake product. So what we've been doing to tackle that is we put the communication on the store level as well as what we are doing right now. So we try to give the awareness for the audience regarding the new packaging itself.
So you're having a relaunch.
Yes.
Where can your customers find the product? And is there anything special going on for your relaunch?
Okay, so whenever they see the Procold, whenever they have been buying Procold, it will definitely be there. So they can always go to their nearest pharmacy to get the Procold.
Are there any special incentives for the relaunch? Are you doing something special for your old customers?
Of course, but for that one, it can wait. It will come soon, but for now, I can tell there will be incentive.
Okay, so you want to keep your customers updated about whatever is going to be going on, and if there's going to be any special freebies for them. So how do they keep up? How do they stay updated with your information?
Okay, they can follow us. You can follow us at our Instagram at Procold Procold_Naija to get more info about the packaging chain and all of our other offers.
Procold_Naija. Any words for your loyal customers?
Okay, so I would like to take this chance to thank our consumer, to thank them for their loyalty, and they have been taking Procold every day, and we hope that we have been making your life a little bit better with less cold, of course. And with this new packaging change, I hope it can bring something new for you, something fresh for you. But we want to keep you to remember that this new packaging is only a different look, but the inside is still the same. It's still the same Procold, same formula, and the same efficacy that you know.
Okay, so tell us a bit about this efficacy. What exactly does Procold do when a person has a cold?
Okay, so when a person has the cold, one of the basic symptoms are the headache and also the runny nose and also the congestion. So Procold itself, with the formula that Procold has, it can tackle all of those symptoms, and you can take Procold and then it will give you relief from the symptoms.
When a person takes Procold, sometimes there's a bit of confusion. You know, a person has a cold and a runny nose, so he wants to take a cold medication, but then he also takes paracetamol for his headache. Is that necessary when taking Procold?
Okay, so when you have those symptoms, actually it can be Procold, because Procold itself already have paracetamol. So I would say there will be no need to take paracetamol, but of course it will be different depending on the person. But if you need paracetamol, it's already contained in the Procold itself. Okay,
so can it also handle both the runny and the stuffy nose?
Yes, with the combination of the formula that we have, it can handle the congestion and also the runny nose.
People who look at your new packaging will see that the old one had the names of 2 active ingredients on it, but now there are 3 active ingredients. What's that 3rd active ingredient? What does it do, and why did you put it there? Since you say the composition is the same.
So in terms of the ingredients, the composition, you can check that the old packaging and the new packaging itself, we actually still keep the same formula, which is the paracetamol, phenylephrine, and the chlorpheniramine. So those are the same composition that Procold has always had before.
All right. So we look forward to hearing more from you, and I'm sure your customers would want to get you on Procold_Naija.
Procold_Naija.
For more information. And maybe freebies.
Yes, sure. We do a lot of social media challenge for our consumers.
All right. Thank you so much for coming on the show.
Thank you.
Nicholas Alexandro, brand manager, Procold Nigeria.
Thank you very much.
And that's it on the show. Thank you so much for listening in. Have a wonderful day. I am Mary Alale Yusuf.